If the patient is having the cough for the last a day or two, then immediately he rushed to take the medicines. But that you recognize in Bengaluru or any metro cities, lot of pollen pollution. When you cross the road, you go 5 kilometers in a day. Or even yesterday, the patient came at around 60 years of the old. But he is telling, because of my age and my survival of my life, I work 40 kilometers per day. I need to visit many shops. I need to take the photo and then send to the company that I visited here. The tracking system is there on the phone, that where are you right now. No, I mean to say around 40 kilometers the person go around the city, then he don't have the cough, but slowly will go and develop and deposit on the somewhere else. That's called as a nasal septum, that's called as a mouth system, that's called as a throat system. Somewhere it go and accumulate. So once it go and accumulate, then what happened there is, see, remember one key point, body created by the Almighty, the body will not keep it anything rubbish. Any foreign substances doesn't keep in our body. For example, you just see when you are eating something stuck in between the teeth, then you are going somewhere, there is gone something foreign substances on your nose or on your eye or on your ear, so that don't keep it for the longer time. It gives a signal, yes, I need to come out, I need to come out, isn't it? When you had something rubbish, then it goes to the colon. Colon doesn't keep all the toxins that need to be evacuate, eliminate. So that process will going to happen in the body, that to be known as a cough. But in 2 days time or the 3 to 4 to 5 days cough you do have, then take the preventive measures and also some kind of the home remedies to suppress and to regulate your system very well. The people consume like a antibiotic medicines, but cough came for your goodness, not for your enemy. Initially it comes, you just see greater than 7 days coughing you have, but don't deny to take treatment also. That is the wrong. But cough is really good. If the cough is there for the last 15 days, then you are not taking the preventive measures, that will convert in the form of the something else also. For the last 1 month you have the cough, then some bacteria is affected, staphylococcus or streptococcus infection is happened to you because of bacteria. Then that convert is slowly in the form of the mycobacterium organism, right? So that causes the tuberculosis. Why you wanted to go and take to that level? But that is the wrong. However, you need to register whatever the cough I told you here. All the coughs are timely good for the persisting for the longer intervals. Definitely we do require the treatment. Now the cough is there, that is the reflux is coming out through the lungs and then throat, irritation, through the irritation some you are coughing. So that happen, then what you need to do, treat for the upper respiratory tract infection. How do you do?
Sir,
you need
is less, sir. Volume is less.
You need to do acupuncture. May not be required acupuncture. May not be required medicines over here. What is required? Required is naturally you required to take the hot water and then use the turmeric and use the ginger, use the salt. So something you can use it, tulsi leaves, right? Crush it and then eat. All these measures to be taken care without using any kind of without acupuncture. May not be required acupuncture as well. So easy comes, then easy goes. But when you take as a preventive measures, you take as an antibiotic to suppress that, but you are not detoxifying your microorganisms, you are not detoxifying the foreign substances which is existing, then tomorrow it will going to develop. Same thing you remember frontal sinusitis, ethmoid sinusitis, sphenoid sinusitis, right? All those sinuses are existing here on the frontal cavity, but the common cold is there. That cold will going to store on the cavities. That yearly once it will destroy through the nose, that running nose, rhinitis. That is good for our health. The people will suppress that by using some of the strong medication, using the acupuncture treatment. May not be required. Naturally, easy comes, then easy goes. But in the pathology, you try to understand and then to know that disease comes, then how many days the disease pertain in our body? Common cold, onset of the action is today, then perhaps 3 days. Maximum 7 days. Eighth day cold will not be there if it is the normal virus is affected. Isn't it? If you take medicine, normally it goes in 3 days. Otherwise it may go on 4th day. If you take medicines, it go in 3 days. But if you take higher medicine, it may go on 2 days. Yeah, that is the problem. But I'm not telling that you shouldn't take the medicines. Maybe you have the conference. You need to go somewhere else. For emergency, you wanted to go. You just consume. But simply taking the medicines yourself is damaging your immune system that leads to the several diseases. That's the reason we should be very careful, especially for the children. No, 1 year, 2 year, 3 years children, they're continuously having the medicines, but every now and then, every 6 months and 3 months will get the cough. And although the antibiotic and anti-productive cough and anti-congestion syrups are existing on the cupboard. So whenever it happens, take that and immediately give it to them 5 ml. So that to own doctor, own medicines. Maybe what is expiry, you just see it is not expired and then give it to them. Because every medicine, the medicines which you are giving, that also need to analyze properly whether it is the upper tract infection or the lower tract infection, or there is a positive gram positive bacteria is affected or the gram negative bacteria is affected. Accordingly, what derivatives of the medicine to be given, whether cephalosporin derivatives are good or the cefixime some kind of the derivatives are good or the penicillin derivatives are good, need to analyze and to be given. For example, when only the upper throat having the problem, tonsillitis, throat pain, then the gram positive bacteria is affected. Then the below the throat, then the gram negative bacteria is affected. Gram negative bacteria is different, positive bacteria is different. So medicines also different. People give it to them, cough, lay low, 3 days, 5 days. Again, it's not subsided. Then they go to the doctor. Again, he will prescribe for 5 to 7 days. Again, they need to be continued. It's not good all the time.